Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study that sheds light on renal amyloid-A amyloidosis in cats, offering new insights into its diagnosis and impact on kidney health. Our story begins with a team of dedicated researchers across Italy and Switzerland and the United States, driven by a desire to better understand this complex disease. Amyloidosis, at its core, is a condition where misfolded proteins deposit in various organs, disrupting their normal function. In cats, amyloid-A amyloidosis is the most common form, arising from serum amyloid-A, a protein produced during inflammation. This protein can transform into insoluble fibrils, accumulating in the spleen, liver, and, crucially, the kidneys. While amyloid-A amyloidosis has been recognized as a familial issue in certain breeds like Abyssinians and Siamese, its prevalence in domestic shorthair cats was considered rare. However, recent studies in Italian shelters revealed a surprisingly high occurrence, prompting further investigation into its characteristics and diagnostic markers. To unravel the mysteries of renal amyloid-A amyloidosis, the researchers conducted a meticulous case-control study involving 29 shelter cats. These cats, sadly, had either passed away or were euthanized due to their declining health between 2018 and 2021. The team examined kidney, liver, and spleen samples collected during necropsy, along with urine samples obtained within 30 days of the cat's deaths. Histology, the microscopic examination of tissues, played a pivotal role in characterizing kidney damage and confirming the presence and extent of amyloid deposits. Additionally, immunohistochemistry, a technique that uses antibodies to detect specific proteins, was employed to definitively identify amyloid-A amyloidosis. Beyond these traditional methods, the researchers ventured into the realm of advanced protein analysis. They calculated urine protein-to-creatinine and urine amyloid-A to creatinine ratios to quantify protein and amyloid-A levels in the urine. Furthermore, they utilized sophisticated techniques like sodium dodecyl sulfate agarose gel electrophoresis and liquid chromatography mass spectrometry to analyze the urine protein profiles and identify potential biomarkers. The results of this comprehensive study were both intriguing and significant. 19 of the 29 cats were diagnosed with renal involvement of amyloid-A amyloidosis. Cats with amyloid-A amyloidosis exhibited higher urine protein-to-creatinine and urine amyloid-A to creatinine ratios compared to their unaffected counterparts, underscoring the association between the disease and increased protein and amyloid-A excretion in the urine. Interestingly, sodium dodecyl sulfate agarose gel electrophoresis, a method used to classify proteinuria, did not effectively differentiate between cats with and without amyloid-A amyloidosis. However, liquid chromatography mass spectrometry unveiled a treasure trove of 63 potential biomarkers linked to amyloid-A amyloidosis. Among these, urine apolipoprotein C3 was found to be significantly elevated in affected cats. Delving deeper into the kidney tissue, the researchers discovered that amyloid-A amyloidosis was associated with glomerulosclerosis, a hardening of the kidney's filtering units, and interstitial fibrosis, the formation of scar tissue in the kidney. These findings highlight the detrimental impact of amyloid-A amyloidosis on renal structure and function. So, what do these findings mean for our feline companions? The study's conclusions are multifaceted and clinically relevant. First and foremost, renal amyloid-A amyloidosis is indeed associated with kidney lesions, increased proteinuria, and elevated urine excretion of serum amyloid-A in shelter cats. This underscores the importance of considering amyloid-A amyloidosis in the differential diagnosis of cats presenting with proteinuria, particularly in shelter environments. The study also emphasizes the need for further research to fully understand the role of lipid transport proteins in the urine of cats affected by amyloid-A amyloidosis. The identification of apolipoprotein C3 as a potential biomarker warrants further investigation into its diagnostic and therapeutic implications. Now, let's explore some of the specifics of the study's methodology and results. The researchers meticulously collected clinical and laboratory data from the participating cats, including serum creatinine, urea, symmetric dimethylarginine, and phosphate concentrations, as well as urinalysis findings. They also documented the cat's medical history, including any concurrent diseases and causes of death. Urine samples were carefully processed and analyzed using a variety of techniques. Urine-specific gravity, urine protein-to-creatinine ratio, and sodium dodecyl sulfate agarose gel electrophoresis were performed at a commercial laboratory, while liquid chromatography mass spectrometry was conducted at a research facility. The urine amyloid-A to creatinine ratio was determined using a turbidimetric immunoassay, a method that measures the cloudiness of a solution to quantify the amount of a specific substance. Electrophoresis, a technique that separates molecules based on their size and charge, was used to classify proteinuria as glomerular, tubular, or mixed. For liquid chromatography mass spectrometry, urine samples were precipitated with ethanol, digested with trypsin, and analyzed using ultra-high-performance liquid chromatography coupled with an Orbitrap Q-Exactive Plus mass spectrometer. The resulting data were analyzed using specialized software to identify and quantify urine proteins. Histological examination of kidney, liver, and spleen samples involved staining with a variety of dyes, including hematoxylin and eosin, periodic acid Schiff, Masson's trichrome, and periodic acid methenamine silver. Amyloid deposits were classified based on their location and scored based on their abundance. Immunohistofluorescence was performed to confirm the presence of amyloid-A amyloidosis. The researchers employed a range of statistical analyses to compare data between groups and identify significant associations. Unpaired t-tests and Mann-Whitney tests were used to compare continuous variables, while chi-squared and Fisher's exact tests were used for categorical variables. Proteomics data were analyzed using MaxQuant and MarkerView software. The study population consisted of domestic short-hair cats from shelters in northwest Italy. There were no significant differences between cats with and without renal amyloid-A amyloidosis in terms of sex, age, breed, or duration of stay in the shelter. However, all cats with renal amyloid-A amyloidosis had chronic kidney disease, and many had concurrent comorbidities such as feline leukemia virus, feline immunodeficiency virus, and feline infectious peritonitis. Histological analysis revealed that amyloid-A amyloidosis in the kidney was often accompanied by involvement of the liver and spleen. Amyloid deposits were detected in both the cortex and medulla of the kidney, as well as in the glomeruli, interstitium, and vessels. Renal amyloid-A amyloidosis was associated with glomerulosclerosis and interstitial fibrosis. Urine-specific gravity did not differ significantly between cats with and without renal amyloid-A amyloidosis. However, cats with renal amyloid-A amyloidosis had significantly higher urine protein-to-creatinine ratios. Sodium dodecyl sulfate agarose gel electrophoresis identified mixed proteinuria in most cats, but did not effectively differentiate between groups. The urine amyloid-A to creatinine ratio was significantly higher in cats with renal amyloid-A amyloidosis. Proteomics analysis identified a number of urine proteins that were differentially abundant in cats with renal amyloid-A amyloidosis. Proteins involved in oxidative stress response, lipid transport, complement system, and coagulation cascade pathways were more abundant in affected cats. Apolipoprotein C3, E, and AI were also excreted more abundantly in cats with renal amyloid-A amyloidosis. The researchers compared their findings to previous studies on amyloid-A amyloidosis in cats and other species. They noted that the distribution of amyloid deposits in the kidney differed between domestic short-hair cats and Abyssinian cats with familial amyloidosis. They also discussed the potential mechanisms of amyloid-induced renal damage, including glomerular deposition of amyloid fibrils, cell toxicity caused by amyloid precursor proteins, and the role of oxidative stress and inflammation. The study had some limitations, including its retrospective design, incomplete medical records, and the presence of bacteriuria in one cat. However, the researchers concluded that renal amyloid-A amyloidosis in shelter cats is associated with renal damage and increased proteinuria. They recommended that clinicians consider renal amyloid-A amyloidosis in shelter cats with urine protein loss and increased urine excretion of serum amyloid-A. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.